working for you. A weekly talk radio program which highlights developments of national interest and the activities of your St. Kitts government. Join host Roy Williams as he presents news, views, reports, and interviews about everything regarding the activities of the Team Unity government and the building of our communities and the development of St. Kitts. Tune in and call in to interact with your government and share your views regarding the upward forward development of your community and our beautiful Twin Island Federation. Working for you is weekly, every Wednesday live from 1:30 p.m. to 3 p.m. on ZIZ Radio, Win FM, and Sugar City FM with rebroadcast on participating stations. Working for you.
Good afternoon, and I welcome you to another Working for You program. I am Roy Williams. Thank you very much for tuning in to today's program. We are going to have a very lively discussion. Today we are going to be talking about our health, which is so important. We always hear that the health of a country is the wealth of a country. We are going to be discussing today what we call Ncds, or non-communicable diseases, and how important it is to sustainable economies and sustainable populations and just being healthy. How important it actually is. Today I have three persons who are on my panel. Well learned, and they're going to be giving you a lot of very pertinent information as it relates to our health vis-a-vis NCDs. I will begin with Dr. Waneisha Jones, who is from Barbados, and she is here because we're having the CAFA conference and so on, but she's here. She's the project manager for improving household nutrition, security, and public health in the Caribbean community, CARICOM. Quite a long thing there. Then we have Professor Thelma Alafia Samuels, well known, and Professor Samuels is the director of the George Allen Chronic Disease Research Center at the University of the West Indies, Cave Hill campus in Barbados. And then we have our very own Mrs. Latoya Duncan, who is Nutrition Surveillance Coordinator in the Ministry of Health. To all of you, a very welcome to this program. I want you to tell me a little bit about yourself, because the audience would like to know a little bit about who you are. So if we can start with Dr. Jones. Tell us a little bit about yourself and what you do.
Okay, my name is, as Mr. Williams said, Dr. Waneisha Jones, and currently I'm working at the George Allen Chronic Disease Research Center as the project manager for a new and exciting project which we've recently commenced, which is all about food and nutrition. And so I'm pretty much helping along with Professor Samuels just to organize all the different events that we have going on concerning this project. And so that's why I'm here in St. Kitts today.
Okay, great. Professor Samuels.
Right, so I'm known as Alafia Samuels.
Alafia.
Yes, I use my middle name.
I see, okay.
Yes, my father was from Sierra Leone and he gave me that name. It's a Yoruba name from Nigeria, so I'm very proud of carrying the name.
Yes.
So, as you mentioned, I'm the director of the George Allen Chronic Disease Research Center, and our real interest and our main focus is in examining what we call the upstream determinants of chronic diseases. So the chronic diseases that we're talking about are mainly heart attack and stroke, diabetes, cancer, and asthma, respiratory disease. And the reason why those diseases are grouped together is because they have common risk factors. So unhealthy eating, not exercising, use of tobacco, and abuse of alcohol all contribute to those four diseases. So we kind of put them together so we can deal with them together.
Okay.
So as I said, we are interested really in the unhealthy eating and the lack of exercise. That's what we research about, and that's what our project is mainly about.
Certainly. And then I have, of course, Mrs. Latoya Duncan, who is the Nutrition Surveillance Coordinator in the Ministry of Health. Tell us a little bit about that, nutrition.
Well, thank you. And as you said before, St. Kitts and Nevis' very own. My role in the Ministry of Health as part of a team, I organize and implement nutrition policies and programs. I also work with local schools, different businesses, different NGOs as it relates to nutrition, regardless of the component or whatever activity they have, as long as it is nutrition related. That is my responsibility. I also work with individuals in the community, and we do individual dietary counseling. We also educate on the role of physical fitness, as nutrition and physical fitness tend to play hand in hand.
Yes.
Okay, thank you so much. Now, let me begin with a very basic question. Professor Samuels, what are NCDs?
Right, so non-communicable diseases are this group of diseases I spoke about earlier, mainly. Of course, you have other diseases too. We can't forget our mental health illnesses are very important and actually play a part in these other diseases as well. And you have a whole range of other diseases, but we are focused on these 4 diseases because we have the heaviest burden from those diseases. And you know, remember that we all are going to die of something, and more than likely it won't be an accident, and it won't be a communicable disease, because we've kind of gotten over most of the communicable diseases now. So it probably will be a non-communicable disease. So really that's not so much the issue. The issue is premature mortality from non-communicable diseases. So deaths from non-communicable diseases between the age of 30 and 69 years. Because when you die at that age, you are losing somebody who is an active contributor to society. And you know, you're leaving their family without that income, without that emotional support, and so on and so forth. So really that's our focus, the people who between 30 and 69, who because of their environment, because of the nature of the foods that they are eating and so on, a lot of times they are getting sick and they are actually dying too soon.
Okay, fine, but great. Why the focus on non-communicable diseases, especially in the Caribbean?
Right, so the Caribbean, you know, in the whole region of the Americas, so we're going from Canada in the north all the way down to Chile, I think is the most southern country.
Yeah.
I'm not sure, but is Argentina? Okay, thank you, Argentina. So between that whole region, the Caribbean has the worst epidemic of chronic diseases and has the highest rates of premature mortality. So in the Caribbean in general, about half of our persons who die before 70 are dying from non-communicable diseases. Whereas in the United States, it's only about a quarter. So our rate is twice what their rate is. And that's in general. And some countries have it even worse. And you know, St. Kitts.
Yes.
Yes.
And I can speak a little to that.
Right. Dr. Jones, why do you think that in the Caribbean there's this high prevalence of NCDs?
Well, I believe that a major part of it is to do with our diet and lack of physical activity, because certainly we see that persons are more so into consuming very high density foods that really have low nutritional value. And so that is one of the major contributors to the obesity epidemic here. And then to add to that, physical activity is not necessarily something that's so common across the board anymore. You go to work, you sit for long periods, and then you drive back home. And so we have individuals who are not being as active as, say, our foreparents were in days gone by. And so the lack of physical activity and the diet is what I believe is one of the major contributors to this obesity epidemic.
Okay, now Mrs. Matthew Duncan, she spoke about diet. She spoke about exercise. These are lifestyle decisions that people must make. Now, you're the Nutrition Surveillance Coordinator. Could you speak a little bit in terms of nutrition, our diet, and exercise in terms of how it relates to NCDs?
Okay, well, to give a little bit about NCDs first, here in St. Kitts and Nevis, there's a major shift taking place in the field of health, and it has been described as a rapid dietary and epidemiological transition where chronic non-communicable diseases have replaced malnutrition and infectious disease, communicable diseases. In St. Kitts, over the past 20 years, heart disease, stroke, diabetes, and cancers have been the leading causes of death, not only in St. Kitts but also in the region. In St. Kitts, for example, the death rate from NCDs are much higher than in North America and in Latin America. St. Kitts and Nevis has 12th place in mortality rates due to neoplasms, which is cancer, 8th place due to ischemic heart disease, 5th due to diabetes, and 3rd due to cerebral vascular disease of the 21st Caribbean non-Latin that are evaluated in 2012.
Cerebral vascular disease, stroke.
Yes.
And to speak specifically to diet, I agree with Doctor. A lot of the issues that we tend to have, persons have more access now to imported food. And I'm not saying that all imported foods are bad. However, majority of the foods that we tend to import in St. Kitts and Nevis are of no nutritional value, foods that we consider caloric dense. Well, some of them are calorie dense. I might hear some persons say that, well, junk food, so to say, to put it in layman terms. And we do not only have a problem with the adult population who have access to these foods, not only because of price but the amount that are on the market, but we also have a problem with our younger population. So you find obesity, which is one of the major risk factors for NCDs, you're finding that now a lot among our school-age children.
Okay. Now, Professor Samuels, earlier you indicated about people dying between 30 and in the 60s and so on, and what that really does to populations.
That's right.
Can you speak, to the economic implications of NCDs, some of the social and political implications as well?
Right, so there have been some studies across the Caribbean, and the economic part of NCDs really has several dimensions. First of all, the Ministry of Health has a budget, which most of it now is being spent on NCDs to actually care for people who have NCDs. But we have to remember that the cost on the family themselves, because the caregiver has to stay home to take care of the person who is sick. You have to pay the bus fare to go to the health center. If you access the private sector, sometimes you have to pay for that. Sometimes the tests you have to pay. So there are things we call out-of-pocket payments. So that's the second aspect. The third aspect is what the country itself loses. Because if you have somebody who is a well-trained person in an organization and that person gets sick or dies, then the company loses a very valuable asset. And not to put it crudely, but the country loses the income tax that they would have collected from that person. You know what I'm saying? So there's an economic dimension to it also, and if you project, into the future, you can see over the years it really adds up. So people are very now concerned about the economic aspect. In fact, the World Economic Federation calls non-communicable diseases the biggest threat to economic development that the world currently faces. So it's a big problem. It's a big problem.
Right.
And the other economic part of it too that we have to talk about is what has been coined the commercial determinants of health. So you have big companies who make profit by selling foods that are detrimental to health, that are causing people to get sick and to die early. And that's another money part of it we have to think of, because you have these big multinational companies. I heard the other day that the sugar sweetened beverage sales in the world each year is 16 trillion US dollars. Not million, not billion.
Yes.
Trillion. So that's a million. Right? So you can understand that these companies are going to be fighting hard to maintain profits for their shareholders, which is fine. Profits for shareholders is good, but we have to find a way to live together where the environment that people live in is not an environment that is pushing them towards obesity. What do I mean by environment? Let's say you have a mother who is going home late at night. She has just come off shift.
Yes.
And she has to take cooked food home for the family. She will take home what is available. If you don't have a healthy option available, she doesn't have a choice to take home a healthy option. So that's when we say the environment is important. It's that kind of thing we're talking about. When you see all the advertisements for the unhealthy food, that's environment also. They advertise because it works. And so you put on $1 million in ads and you get $2 million in sales. Right? So that again is an economic aspect, but it's also an environmental aspect. So yes, it's a behavior, the individual's behavior, but the individual is within an environment. And we need to make sure that the environment helps the individual to make the right choice and the healthy choice.
What about the social implication? Because of course you spoke about the economic, but in terms of families now being burdened
Yes.
with having to take care of, and how that affects the whole social unit.
Yes, absolutely. That's right.
Yeah.
It does.
And then the political implications.
Yes.
I'm going to leave that one alone.
You're going to leave that one alone.
No, I will take it on, because really public health is politics of health.
Yes.
Right? Let me give you an example. This is not really politics, this is public policy.
Yes.
You can have a situation where in a government, the Ministry of Education is agreeing to do certain things that is against what the Ministry of Health is trying to do. The Ministry of Education may allow certain vendors in the schools to sell unhealthy foods because they want to make the profit and so on and so forth. But the Ministry of Health, on the other hand, is saying no unhealthy foods. So you see, there needs to be some kind of political resolution to those kinds of problems. Because it's one government, so the government needs to decide what are the priorities.
I totally agree. Right. Dr. Jones, I'm back to you. What is meant by household nutrition security?
Well, household nutrition security, its basis is in the concept around food security. And food security in general is referring to, or exists actually, when all people at all times have physical, social, and economic access to sufficient, safe, and nutritious food, which will then meet their dietary needs and food preferences. So it's a very long definition around it, but some of the important aspects are that everyone at all times must have access to this nutritious food. And so then if we hone in on the households now, we can then apply the broad definition of food security to each household to say that we want every single household in every country really to have access to these nutritious foods that we all need to live a healthy life.
Okay. So, but what is being done in terms of awareness? Helping people to be more aware within households how they can, have better nutrition. I know that you are based in Barbados, but for example, what is the George Allen Chronic Disease Research Center doing to develop awareness in terms of nutrition security?
Well, in general, I'll start from in general, and Professor Samuels can help me a little bit when we come to the Chronic
Of
Disease
course, she is the
Research
director.
Center. But in general, we have various Caribbean countries, Barbados, Jamaica included for sure, that are producing some PSAs, so very short, 1 minute or thereabout ads to say, well, these particular foods are unhealthy, and there's a particular drive really towards sugar sweetened beverages at this current moment. And so there are some ads in Jamaica regarding that. There's some in Barbados as well. And our Ministry of Health in Barbados have also put out ads regarding salt intake. And so we have the ministries in varying countries that are trying to spread the word by that medium. Right? Additionally, we are trying to well, this will not be at a household level, but seeing how we can engage the policy makers in terms of sugar sweetened beverages as well. I mean, but that's not exactly what we're delving into today, but just to mention that that's another route by which we are trying to address this issue of improper nutrition.
Sure. Would you like to add anything?
Yes, I'd like to add a couple of things. The ministries of health all have health promotion units, and we can hear some more from Mrs. Duncan about that. So the health promotion units are trying to do what they need to do, but we need to recognize that, you know, at the final analysis, when people come to make a choice, yes, what they have been told in the health center is somewhere there in their mind. But when they go to make that decision, they are deciding based on price, based on taste, and based on the appetite that has been created over time for this particular food. So what the governments need to be doing to kind of try to level the playing field: taxation, regulation, legislation. The same thing we did with tobacco, because really some of the foods are not exactly tobacco, but the effect some of these foods have very negative effects. And so just like how we labeled tobacco, and you know, you see the label on it, it's a danger to your health.
Yes.
There's actually a proposal that we are working on now with the government of Chile and CARICOM for front of package labeling, so that the packaged foods will all have high in salt, high in sugar, high in calories, high in fat. So people can make an informed decision when they go. The other thing that we need to do is that we need to impose taxes on unhealthy foods so that they become more expensive, and the cheaper foods, we need to try and subsidize them so that they become less expensive. So when you go to the shelf, the healthier thing is cheaper. So you would more tend to buy the healthier thing. That's an environmental issue. That's why we have to create an environment that helps people make healthy choices.
Yes, I know in St. Kitts, Mrs. Matthew Duncan, that we're developing a culture, a fast food culture. And you find KFC is always packed with people, not, you know, saying anything about KFC, because I go there myself sometimes, not every day. And people tend to be moving towards food that they can get fast and that's cheaper.
Yes.
So you find there's a lot of people, the Chinese are doing very well here, actually. You can get $7 and you can get a whole heap of rice and what have you. What do you have to say about this culture that is developing?
Well, you're so right about the culture that is currently developing, should I say, in full gear here in St. Kitts, as relates to fast food, and sometimes not only speaking to the fast food chain, but we also have a culture where, for example, we have persons who every weekend it is acceptable not to do home cooked meals, and it is okay to go to a fast food chain, whether to get chicken and chips, different fast food from different public entities that have these foods available. Now, what we in the health promotion unit is currently trying to do, we are trying to encourage self-care, where we want to empower individuals to make right decisions. I just said earlier, KFC is there. KFC is available to everyone. If persons want KFC, they should be able to, if they want to, but as you say, it's how often these persons are going to patronize KFC, for example. This is what we want persons to know, that we are not saying that you cannot have a certain types of food now and again, but it's how regular you are going to have this food item and how much of this food item you are going to have.
Yes.
When you start developing cultures like that, there's something known as learned behavior, where if you have a family, for example, and this family is accustomed to only eating chicken fry, then there's a high possibility that that family, that is how it is going to continue throughout generation and to generation. Every time they prepare chicken, they would have to fry chicken. So what we are trying to do in teaching self-care is to educate persons to make better decisions, to more plan their meals, plan healthier meals so they don't just spontaneously get up and say, well, I don't want to cook today, I don't have enough time to cook, so let me go into one of these fast food franchise and purchase something that would most of the time be unhealthy to eat.
You know, sometimes when you are young, you feel as though you will never die. You're the immortal young person, and you don't get sick, and you're invincible, and all that sort of thing. And so you can eat whatever you want.
Yes, well, first thing is that we estimate that there are thousands of children between the age of 10 and 19 who have high blood pressure because of obesity. This is not something that was common in the past, because high blood pressure is a disease of advancing years. But now the children are getting it. Also, the children are getting type 2 diabetes. Adult onset diabetes is occurring in children because they are too fat. So this idea that young people have that, even if I get a problem, it's 20 years down the road. It's not so. They can get problems today. So, I think that people need to be aware of that. I think that the doctors need to be checking all these young people's blood pressure, because some of them are high.
So you are saying that the awareness has to begin at a very early age.
Yes, absolutely. And let's not forget that you also have chronic diseases among children. I belong to a group called NCD Child, and one of the things that they are trying to do is to make the point that chronic diseases occur among children as well. We have a lot of cancers that occur in children. Asthma is a major problem in children, and a lot of these issues have to do with lifestyle. So it's important for us to really think about how we live.
Right. Now, in terms of the financing strategies to deal with NCDs in the region, do you have any idea of this?
I know it's going to bankrupt countries. This NCD tsunami that has started and is coming for us in the future is going to bankrupt countries. We are not going to be able to afford it. Look at the issue of, for example, of dialysis. Most people on dialysis have either diabetes or high blood pressure is what caused them to need dialysis. As we get fatter and as we age in the society and as we have all of these risk factors, the government is not going to be able to afford to pay for all of these services. So we really, the governments are facing a crisis coming up.
So it is basically making our societies poorer.
Yes.
Because there is less gross domestic product and gross national product.
Yeah.
People are being less productive because of these NCDs. Now, Dr. Jones, you mentioned something earlier which I find very interesting. And this is me summarizing that NCDs are becoming chronic emergency in middle income and low income countries. Why? Because the Caribbean, most of our societies are middle income and low income.
No, wait, only Haiti is low income.
Haiti is low income.
Yeah, but the rest of them are middle and high.
Yes, middle and high income.
Yes.
Do you think that somehow that poor households or people with less income are more likely to come down with an NCD?
Yes, I actually believe that poor households would be more likely, and one of the major reasons are that the foods that we mentioned previously that are of high caloric density are usually the cheaper foods, and so you would go and you would buy your soft drink or your sweetened beverage,
Corned beef,
or your corned beef, high in salt, etc. So because of the pricing of these goods, this is what they have most access to. Whereas you would find that the healthier foods, when you go to the supermarket, those are the things that are costing you more. And so therefore, as an individual that has less income, I'm going to buy what I can afford. And so then I end up in a situation where I have to use, quote unquote to use products that are not the best for my health.
Now, slave societies, we all know we were part of slave societies, used to get a lot of salted meats.
Yes.
The saltfish and the
Pig's tail.
pig tail and the
Yes.
pig snout
Yes.
and the what we call the red herring, which is really smoked herring, really.
Yes.
And so on. Do you think that has had an impact in contributing to NCDs?
Well, I for one definitely think so, and it's not only about the foods that already come that contains high percentage of sodium or salt. As to say, sometimes it has to do a lot with food preparation.
Yes.
As you said, and some persons like to blame it and say culture, that is how I was brought up, as you spoke about the canned pork and the whole work. Up to recently I had a presentation and we had a discussion about canning your meat back then, and then I said to them, why did persons can their meat back then? It was for preservation. What do we have? We have refrigerators today, so there isn't a need for so many sodium or salt like persons are using today. But persons tend to consider it culture to feel it is acceptable to ensure that whatever meal they are preparing or whatever meal they are consuming, they have to taste the salt in it. So persons tend to overdo it. So from the start of the cooking process to the end, more and more salt is added to please their taste buds that are already adapt to this high salt foods. So I think definitely it have contributed to it.
And sugar.
Can I just, before we get on to sugar, which we need to talk, can I just say though that the whole salt thing also is partially in your mind? Because they have done experiments where they have put food that have full salt and food that has 10% less salt and food that has 20% less salt. Most people cannot tell the difference in the taste. So people can really start to cut down their salt without losing the taste that they like.
Yes.
And once you get accustomed to the 20% less, then you start from there and you can go down again,
Right.
gradually over time, and you start to reduce the amount of salt that you are having in your diet.
Yes. I was going to mention, the salted foods I mentioned, the saltfish and the smoked herring and the pigtail and so on. Once ago, that was considered to be poor people's food. But now, it is extremely expensive.
And it's
Yeah.
cultural food.
Yes.
The other thing too that we have noticed is that in some countries, the government actually subsidizes these foods. So we come back to the question of politics and making priorities in the country.
Yes.
Right? The government is taking taxpayers' money to subsidize food that is making people sick.
Wow. Okay. Now, NCDs present a particular daunting challenge back to for middle and low income countries. So we've moved out. We are middle now
Middle
and
high income, yes.
because of the scale of the burden relative to their level of economic development. Can you elaborate on this a little bit for me?
Well, as we said earlier, one of the reasons why we are having so much bombardment by what is called big food and big soda, because that there are some large companies in the world that operate in every country of the world, right? And they have strategies to get in there and to get you to buy. The color of the bottle, the shape of the bottle. Some people put your name on the bottle, right? So many marketing strategies are being used. And the issue is that as the Caribbean has developed and as we have moved from lower middle income to upper middle income and high income countries, disposable income is available to a number of people in the society. And where there's income, there's opportunity for profit. So naturally, the companies come in, the marketing comes in, right? And the taste buds of the population is being changed through all kinds of methods. Free samples and school tours and what we call obesogenic pricing. What do I mean by that? You can get 4 ounces for $4, but you can get 8 ounces for $5. So obviously you're going to say 8 ounces for just $1 more, let me buy that. Once you buy it, you say, I pay the money for it, I have to eat it. So the pricing is encouraging you to eat more. And this is again environment. These are things that we live within the environment that encourage unhealthy behavior.
Yes. Now, we were talking about sugar. I remember talking about salt too. But here in St. Kitts, when we make fruit punch, I always wonder why it is so sweet. Extremely sweet. And I've asked because I'm trying to get an answer. And people said, well, I put ice in there, so the ice is going to dilute the whatever. That is actually the answer that I get. I never can understand why it is so sweet.
No, well, I cannot help you to answer why it is so sweet either. But as you said, to that theory, even for diabetic patients, for example, they might consider consuming 1 bottle of carbonated drink that might have in more than their daily required amount of sugar.
9 teaspoons of sugar.
Of that day, and they feel it is acceptable if they follow that bottle with a bottle of water that equals to the same amount. Now, regardless of how you
They're diluting it.
It's
the same.
It's the same. So whether you add ice or you add water, and you're going to consume that same 8 ounce of extremely sugar sweetened beverages, you still will get the same amount of sugar. And the issue that I'm finding here in St. Kitts is not only, a lot of it has to do with how we drink, of course. For example, the school survey that was done in 2011 that looked at teenagers and how many sugar sweetened beverages they tend to consume, speaking specifically to carbonated beverages, sodas, you found that more than 50% of the students who go to schools consume at least 2, some more than 2 in one day. Now that's a lot of sugar. That's a lot of sugar. And then the next issue we tend to be having, persons don't recognize that if you buy a packaged item, whether or not you taste it full and sweet, or you don't get all the sweetness from it, that do not mean that you do not have in sugar. There's something known as added sugars that tend to be in packaged foods.
Yes.
And there are things out there that can be manufactured to ensure that the taste bud or the tongue, for example, the sensory in your tongue, that when you taste something that is too sweet would make you say, this is too sweet, I'm not going to consume it. There are things out there that can reduce that. So you can have the same amount of sugar that you probably mix in your punch, and for somebody who would say, well, I can't drink this is too sweet, you can get it in a packaged item and you don't get that effect, but you still would get in the same amount of sugar. So a lot of packaged food is for blame here in St. Kitts also, and the sodas, because a lot of persons, they'll say, well, I don't eat a lot, but what are you drinking?
And this is Sugar City. St. Kitts is referred to as Sugar City.
Really, is that right?
Yes.
Wow.
In fact, there's even a calypso that say 1 pound of sugar, 2 pounds of sugar, 3 pounds of sugar. Packing on the sugar. Because we think the more sugar, the sweeter we are.
Yeah, but sugar and drinks are a particular problem.
Yes,
Particular problem. Because you know that drinks don't satisfy hunger. Because no matter how many calories you consume in a drink, you're still hungry an hour later.
Yes.
You need solid food to satisfy that hunger. And the other thing is that when you have these sodas, that is really just sugar and water and a little coloring. What happens is that your blood sugar goes up really, really fast. And so the insulin response goes up really, really fast. And then you get what we call a sugar crash. So that your blood sugar actually settles below the normal. So you're hungry.
Yes.
So you go and eat food or you go and drink again, and it produces the same problem of more and more calories coming into your body.
So that explains why some people eat so much.
Yes, sometimes it's the sugar that's causing you to be hungry. That sounds strange?
Sounds a bit
The sugar
strange.
is causing you to be hungry. Yeah. So sugar in drinks, we could do without that altogether.
Yes.
Drink water instead.
So eating more doesn't mean that you're eating more of quality.
No.
Right.
Basically. You can eat less. And somebody who eats a mountain of food, you can get more nutrition.
Yes, because we say, for example, right, that half your plate should be vegetables. You can eat any amount of vegetables you want. Of course, it has to be prepared, right? You know, you can't deep fat fry it and all stuff like that.
Right.
But a little stir fry and fresh vegetables, and putting the vegetables in the meat when you're cooking it, right? half your plate should be vegetables. You can eat as much as you want, fill your belly. Good for you.
Right.
Exactly.
Okay. So we've looked a lot at the problem. And I want us now to start discussing more the solutions. Of course, we've touched on some of them. What is required, Dr. Jones, to change the present rate of persons living with NCDs in the Caribbean?
So there are many avenues that we can take, but we'll start with one that most persons are most familiar with, which is, of course, health education. And we've been educating for years on end, and so we know that health education itself and alone is not the only way to face or to tackle the issue. So in addition to that, we have to ensure to create supportive environments. And earlier, Professor Samuels would have mentioned that the environment also includes the marketing environment. It also includes whether or not, because we mentioned physical activity, whether or not the neighborhoods are walkable, right? What's the walkability of the region that I'm living in? Do I have the necessary, I guess, amenities nearby our supermarkets that provide the nutritious foods? Do I have a nearby park or gym that I can be a part of to increase my physical activity? And then in addition to that, there are interventions that we can do in terms of at the policy or ministry levels. And so one was briefly mentioned, which would be the taxation on the harmful foods, which would include, of course, our sugar sweetened beverages. And looking at that, it would also include trying to get into our school systems as well through the Ministry of Education, because we mentioned heavily that children are very important here because they're being as affected as adults are being affected. And so getting into the schools and yes, educating, but also trying to improve the school meal systems will be very important. And in order to do that, we would then also have to engage members of our civil society. So getting our farmers on board that potentially can contribute goods to the schools so that it can help to implement a healthier school meals system. We can also add, and I should have mentioned this along with taxes, that you should ask governments in terms of subsidizing then the healthier alternatives so that they too can be more available to the householder.
Right.
And if my colleagues, if you have anything
I know here in St. Kitts, the Ministry of Agriculture has every year what it calls Eat Local Day. It's trying to promote people eating foods that are local rather than the imported stuff. Now, we have some things here that are local, Professor Samuels. People make local drinks here. And the local drink is full of sugar.
Yes, yes.
There's no regulation. Sometimes I want to know, they tell me they're selling me lemonade, but I want to know if it's really swank that I am drinking. You used to have something called swank.
What is that?
When we were growing up and so on, and you're poor and so on, you just take sugar and water, and you mix sugar in water, and you drink that, and you're gone. It gives you a little bit of energy and so on. Hardly any lime or hardly any lemonade in it and so on, and I really think it is a rip-off.
Yes, I think we need to be clear that local does not mean healthy. No, because you can actually import fresh fruits and vegetables, and that's healthy. And you can have a local drink that you just described, which is very unhealthy. Now, one of the things with local production, though, is we have to look at the farming.
Yes.
I have heard that young people in St. Kitts and Nevis are not enthusiastic about farming. However, I have also heard that you used to have a farm to fork project, and we can talk about the new project in a second. But the farm to fork project mainly in St. Kitts, and then there are some other interventions in Nevis, where there's a school. Remember the name of the school, Waneisha, please? Charlestown School in Nevis.
Secondary school.
Which has this greenhouse and other plots of land where they are planting wonderful fruits and vegetables, and so much so and so successful that they supply their school and they can be selling to other schools.
Yes.
So I think that that to me was a beacon of hope. When I heard about it, I was so excited, because I'm saying maybe, you know, it's the young people who are in school that we need to reconnect with the earth and the things that grow out of the earth. Because when you see something grow out of the earth and you eat it, it's a different thing from when you just go somewhere and buy it. You feel differently about the food. You feel connected. And that's what we need. We need to get connected back to real food. Cut out the middleman and all the processing.
Yes.
You look at these things, sometimes you can't even pronounce the things in them. All the chemicals in them. It's bad for you.
Sodium nitrite and sodium benzoate and all kinds of... A lot of sodium this and sodium that. That's being generous. That's being generous. I can't even pronounce that. You're correct. The chemicals.
Chemicals in the food, man. It's bad for you.
Right. Okay. Now, in terms of the United Nations, of course, you know, you have the SDGs.
Right.
The Sustainable Development Goals, the 2030 Sustainable Goals. Now, why is tackling NCDs so important to achieving these Sustainable Development Goals?
Well, you know, now we have a Sustainable Development Goal that is actually about health, that talks about and sets targets for reductions in chronic diseases and so on. But the control of NCDs is also very important for achieving other components of the Sustainable Development Goals. Sustainable development cannot happen without healthy people.
Right.
So in a lot of these things that they're talking about, the targets of sustainable development, you need healthy people for all those things to happen. So we are like a basic input into the whole mix to get the output of development. Health is an essential component for development.
And there can be no sustainable development without it.
That's right.
Right. Now, in terms of the approach to tackling NCDs now, it cannot be a mono-sectoral approach.
Right.
It has to be a multi-sectoral approach. Could you speak a little bit to that, Mrs. Duncan?
Here in St. Kitts, a lot of time the Ministry of Health, in collaboration, especially with the Ministry of Education and the Ministry of Agriculture, we tend to perform various activities to help to look at the multi-sectorial approach to NCDs. For example, earlier Professor Samuel mentioned the Farm-to-Farm project. Now, the Farm-to-Farm project was one of these interventions that was along that road. It involved Ministry of Agriculture, Ministry of Health, and Ministry of Education. In March 2011, researchers from the University of the West Indies in Trinidad and Tobago and the McGill University in Canada began working together on this project. Their aim was to improve nutrition and health of the CARICOM population through sustainable agriculture. And of course, they looked at tackling obesity and the issues we're having by targeting the school meals program to ensure that children had more nutritious meals. That was served from the school meals, so it incorporated different farmers, different persons from education, and of course the main stakeholders, which of course the children. So this is one of these activities to which you look at multi-sectoral, because what persons have to understand that health is not just something that the Ministry of Health is responsible for. You are responsible for your own health. Different departments are responsible for their own health. Not because it says the Ministry of Health, you mean everything that have to do with health, it have to be Ministry of Health. Everybody have to be involved, because health affects everybody. As you started this show and saying, you need a healthy population. So in order for the population to be healthy, you need to ensure that everybody is a stakeholder and everybody is involved.
You know, I give my students this anecdote sometimes. I say to them that the Minister of Finance can save more lives than the Minister of Health.
Wow.
Why do I say this?
Policy.
When you put on a big tax on tobacco, it reduces consumption, it reduces heart attack, it reduces stroke, it reduces lung cancer. One signature of the Minister of Finance can do that. The Minister of Health can't save all those lives with one signature, you know, in that kind of way. So this is the point that we're making about the multi-sectoral determinants of chronic diseases and the multi-sectoral response that is required. It's not a Ministry of Health thing. You know, the Ministry of Health does not feed people.
Yes.
The Ministry of Health doesn't import these unhealthy foods. The Ministry of Health is not responsible for schools, right? So all of these components and all of these agencies and these sectors have to come together if we are to get a healthy society.
Right. So we're talking here policy.
Yes.
There has to be policy, and that policy has to look at a number of things. So there has to be a multi-sectoral approach. There has to be also a regional approach.
Yes.
Isn't that so in the Caribbean?
Absolutely.
And I suppose that is one of the objectives of having the CARFA meeting,
Yes.
conference. What about in terms of training health professionals in delivering preventative services? That might be that's probably policy too, but what's the importance of that?
Well, it would be very important to, as they are the contact that the patient would usually have, and they're the persons that most people in society will look up to for advice as to how to manage any diseases they may have now, but also more importantly preventing them. It's definitely important that they have a good grasp of what contributes to a healthy and active lifestyle, and discussing with them how we can go about intervening in the food system to try to figure out how food gets from, as you say, from the field to the farm,
Yes.
etc., and what are the processing mechanisms. It's still important for a healthcare provider to have some knowledge. It might not be in depth, but some knowledge there, so that when patients do come and present to them, that they're able to give them good advice based on knowledge that they would have of the background of the food systems.
Yes.
I want to also add, to complement what Dr. Jones has just said, in that we need to be doing more of this education, not only through healthcare providers, but obviously the nutritionists are the professionals in this
Yes.
area, but also through the schools. And this new project that we're going to talk about in a second, one of the things that we have done is coming out of the evaluation of the Port of Spain, the heads of government
Yes.
declaration on chronic diseases. We did an evaluation, and the conclusion of that evaluation really that our weakest areas were in schools, unhealthy diet, and communication. So the new project is starting off where the old project ended.
Yes.
And one of the things we are proposing is that we work with CXC to revise the curriculum for some of their subjects, so that in the classroom, the teachers and the students are learning not only about what is driving the NCD epidemic, but also are learning skills to help them deal with the environment in which they find themselves, and to make better choices, and to make lifestyle interventions. So we have a number of different areas at which we are working, both at the policy level, at the educational level, as Dr. Jones says, at the one-to-one level. But remember, we talked about the environment and the importance of the environment being supportive of healthy living.
What about, we speak about the environment, we speak about social factors, we speak about economic factors, we've spoken about political factors. What about genetic factors?
Well, that's true. Genes have a role to play, but there's nothing we can do about our genes.
Yeah.
So the best we can do is to change what we are able to change. But we do know that genetic factors play a role. Age also. Age is the greatest determinant of ill health and death. And in terms of genetics, we know that East Indian populations are particularly vulnerable to diabetes. And we know that African populations are more vulnerable to high blood pressure. But, what can we do about that? Nothing. So let us work on what we can work on to make our chances better.
Right, so we have to tackle the risk factors.
Yes.
Yes, and to just add a little bit to Dr. Jones about prevention, and Professor Samuels, who spoke about creating an environment, there is something very important that is used to prevent NCDs that a lot of us take for granted and we don't realize. Now, a lot multiple research are being done now on breastfeeding and the prevention of obesity and NCDs as it relates to adulthood. No, I don't mean that you need to be breastfeeding anybody up to adulthood. That's not what I'm saying. But there's
some people still do.
There's an initiative known as the Baby Friendly Hospital Initiative, and you look at exclusive breastfeeding for the first 6 months of that baby life. So this is one of the things the Ministry of Health is trying to push, and we are getting outside training to help our nurses, the different persons involved, to promote and have more education as it relates to breastfeeding. Because if you start that baby right, exclusive breastfeeding the first 6 months, no water, just breast milk, nothing else. Persons tend to get this confused and think that you can have water. Okay, but it's just breast milk for the first 6 months of life. You can prevent NCDs in some adults later on in life.
And
so it means you reduce the risk so greatly.
Yes. But let me just say that we talked about commercial determinants of health.
Yeah.
There are strong commercial interests who are working against breastfeeding because they want to sell their formula.
Yes.
So they try to come into the hospital and try to get that nipple bottle into the baby's mouth before the baby can even sleep the first sleep. Right? And we really have to be very firm to create an environment in the hospital that supports mothers and babies to start the breastfeeding process without the bottle being there. No bottles in hospitals.
Interesting. Now, ladies, we are going to go to the phone lines. This is where we hear from the people in terms of, their questions and their comments and so on. So we are going to open the lines now. The international number to call is 1718-577-2916. That is 1718-572916. And the local number is 465-2555. We await your calls. Today we are here with a 3-member panel. Professor Dr. Samuels. Alafia Samuels.
Thank you.
And I remember that's a Yoruba name.
Yes.
What does it mean?
Peace has come into the household.
Peace has come into the household.
Don't laugh.
And Dr. Waneisha Jones. And we are here with Mrs. Latoya, Duncan, Matthew Duncan. I got it messed up. We await your calls. Working for you. Good afternoon.
Good afternoon. I'm calling pertaining to the discussion. Hello. I'm calling pertaining to the discussion on breastfeeding.
On breastfeeding, certainly.
Yes. I too would say it has its benefits, but also I think it should start as well that you should encourage mothers to eat. They have to eat healthy as well, because I think the process of encouraging full breastfeeding for 6 months is because of persons don't produce milk. It causes frustration to the mother when the child, is not properly fed or is not satisfied when the child is being fed because they're not producing milk. But if the individual is not eating or having a diet that helps to body to produce milk, that is why most mothers turn to formula at an early stage. So that also should be put out there, that they have to also, the mothers, start eating healthy as well.
Okay, thank you for your call.
Thank you, Carla, for that input. I must agree with you that we do need to encourage, and we do a lot of that. We try to promote all mothers throughout pregnancy and even before pregnancy, personal childbearing age, to try to eat healthy. It is something that needs to be adopted by the entire population. However, just to add a little clarifications as it relates to breast milk production. Now, breast milk, to put simple, supply comes by demand. So if, for example, you have a baby who is continuously sucking, then that milk would be continuously be produced. So sometimes the issues as to why mothers aren't producing enough milk, as some persons would say, Now, breastfeeding is not a simple task. That's why you need the right support system. You need to ensure that you have the proper education, and that's why we have different persons in place to help to assist individuals with this issue. Now, there is a lot of benefits to breastfeeding, as we discussed, not only to the mother, but also to the baby. Not only to the baby, let me turn it around, because persons tend to think that the benefits only benefits the baby. But we also have a lot of benefits toward the mothers. And now we are even looking at benefits in the workplace, different benefits in the community, because you'll be producing a healthier population if you have more breastfed babies. But back to the issue with mothers not producing enough breast milk, sometimes it's some persons might have some mental issues, and I'm not speaking, let me put it, psychological issues, where sometimes this stress, especially on new mothers and breastfeeding, and you have a baby who is continuously fussy, sometimes you have those issues, and sometimes these can be some of the hindrance too, the difficulties to breastfeeding. But once you have a baby who is sucking exclusively, and that baby is sucking continuously, the mammary glands, the breast, will continue to produce milk for that baby.
Can I also add to, in terms of the benefits to the mother? I mean, there are immediate benefits in terms of losing some of the baby weight and your uterus contracting and all that. But there's also a lower risk of breast cancer in women who are breastfed. So you have definite and direct benefits from breastfeeding in addition. And just to add also one other point, that women can also express the breast milk, and then they can give the baby the milk that has been expressed. Yeah.
Okay. Good. Now, we were talking in terms of policy. And of course we can say all what we want, but there's need for resources.
Yes, resources, yes.
So resources have to be mobilized.
Right.
For implementing certain strategies and programs and so on.
Right, and I really want to take the opportunity of thanking the Canadians, the International Development Research Center, who have been really very generous to us in the Caribbean. They helped to fund the 2007 CARICOM Heads of Government meeting. They helped to fund the evaluation of the Port of Spain Declaration, which we just completed. And they are also very generously funding this new project that we have coming on board now, which is a household nutrition security project.
Yes.
And as you said, it takes money to do some of these things. So, for example, we mentioned the CXC curriculum revision earlier, which is part of this project. And it takes money to bring the teachers together, to have the meetings, to have the discussions, to do the revisions and so on. And we're getting some support from the project for that. So the project really is in two main pieces. The first set is the first piece of the project has to do with really getting the evidence together, and not necessarily doing original research again, because we have done a lot of that, but looking at some of the research that has been done and trying to bring that together. The other thing for St. Kitts is that, and Nevis, is that we are going to be having stakeholders interviews. In fact, they're happening right now. The team is on Ireland doing some of these interviews right now. And is it in October we have the workshop here, or November? In November we're going to have a stakeholders workshop here, where we're trying to involve everybody in the food system, the importers, the manufacturers, the farmers, the consumers, and so on, sit together to try to figure out how the system works right now and how we can change it to make it easier for people to eat healthy.
Okay. Now, I know we spoke a lot about the economic and the social and the political and so on, but I have two medical doctors on my panel. I would like you to speak a little bit about what Ncds, what they do to the body physically in terms of the harmful, having an NCD. What does it do to the body? What are some of the adverse effects on the body?
Right, so I could begin. So we mentioned that some of the non-communicable diseases, when we look at the risk factors, truly, you have the obesity, the hypertension, and the diabetes. So the way that all three of these, which are the major risk factors that we consider, can lead on to our heart attacks and our stroke would be, especially with the hypertension, of course, with the increased pressure and force on the blood vessels, that can contribute potentially to persons having stroke. Additionally, persons that have a high cholesterol, which is something we didn't explicitly mention before, that can lead to buildup of what they would know as plaque in the vessels, and these can lead to also hardening of the blood vessels. If you have a break off of the plaque because of then your high blood pressure and the turbulence, then you can have that clot traveling toward the brain and then leading to a stroke. With diabetic patients, all of these really, I guess, when you have all of them, they all contribute and have a synergistic effect. Not that it's a good one, but they all combine to increase your risk to go on to these other diseases. But diabetes in particular, we know firsthand in the Caribbean the issues you have then with wound healing, because with the high levels of sugar in the blood, and then you have your white cells that are supposed to help with infection being quote-unquote lazy, and then therefore it takes very long for wounds to heal in patients that have the diabetes. So those are some of the ways that these diseases would directly affect the body and lead on to our stroke and our heart attacks, etc.
So I also wanted to add that patients who are living with diabetes, the most important thing for them to do is to control their blood pressure. Pressure. Hear what I said?
Interesting.
Blood pressure.
Because I know that people say that both usually go together, and I know people with both.
Yes, most people who have diabetes also have high blood pressure. But because diabetes, we call it sugar, we always tend to think that the most important thing to do is to control the sugar. It is more important to control the blood pressure, because people with diabetes die from stroke and heart attack double the rate of people who do not have diabetes. So it is very important that the blood pressure be normal, not just control a little bit to be a little less than what it was before. It needs to be in the normal range. So if you need to take 2 or 3 different medications, you need to take those medications to keep your blood pressure in the normal range. Medication compliance. A lot of people who have chronic diseases stop taking their medicine. Some people are using complementary medicines. I say to my patients, look, you want to use moringa or noni? No problem, but take my medicine as well. You can't substitute the medicine, the prescription, for these other things. These other things can help, maybe, but they can't solve the problem for you. And so it's very, very, I can't overemphasize how important it is that people take their medication. And if you have some side effects, I know the men are very concerned sometimes, you know it is. Go to the doctor, he can change it for a different medicine. If that medicine is causing you a problem, go and talk and change it for a different medicine, because there are many types. But we need to take the medicine because that is what is going to keep our blood pressure down.
What are the men concerned about? Libido?
Yes, impotence, yes. There are some blood pressure medications that cause impotence.
Yes.
But there are many classes of blood pressure medications. So you go and the doctor puts you on a different class of drug, and then you don't have the problem anymore.
Okay.
And if I might just add here, is that sometimes patients, you give them the medication, they feel better and they think, I feel good, so my medications aren't necessary. But it's important to know that these are silent. You always hear these are silent killers, silent diseases. And you can't go based on how you feel on a particular day. If our recordings have shown and we've diagnosed you with the disease, you have it, regardless of if you feel it or not. And so it's very important to know you can't just go based off of that. And so you need to continue to take your medication on a daily basis. Sometimes patients say, I'm taking my medications, and when you delve deeper, they may be taking it 3 times a week. They may skip days, right? And so, as Professor Samuels mentioned, it's important if you have any issues to come back to your physician, because you may feel unwell and decide, okay, I'm going to just take it Monday, Wednesday, and Friday, and this will be enough, because that's almost half of the week, and I'll be good. But those things you cannot do. So it's always important, if you're having any issues, to seek counsel with your primary care physician.
Okay, we have a caller working for you. Good afternoon.
Yeah, good afternoon, Mr. Williams and your guest.
Good afternoon, sir.
Yeah, I have a question. Now, I hear one of the doctors say that a lot of people, depend on, the noonie and the meringue and whatnot, but they should still take their medication, which I agree with that. I agree with that 100%, because we know the good book say, knowledge shall increase. But with these prescribed medication that the doctors prescribe for us to take, don't the additives that they put in these things have effects on us? And so my guess is this: since the noonie and the meringue and those bush are naturally made and placed on the earth from the Creator, I believe they have something in them to help to fight the additives that these pharmaceutical people put in these prescribed medication. I will listen up the ear for the answer.
So the question, as I understand it, is the additives in medications. Now, let's tell you that a lot of those medications come from nature as well. They are just that they take them from plants and they refine them and so that you can have a consistent dose and so on. But a lot of medications come from nature.
And a lot are synthetic as well.
Some are synthetic, some come from nature. Now, yes, medications can have side effects, but the other things you are taking have side effects as well. A lot of patients will say, oh, I don't want to take this medication because it has all of these chemicals. But they're eating corned beef, they're eating pig's tail, they're eating all these unhealthy foods that have even more chemicals in there.
So there's inconsistency.
There's inconsistency. You are eating a product like corned beef that has all these chemicals in there that's hurting you, but you don't want to take a medication that may have some additives because you say the additives going to hurt you. So you eat the corned beef, but you don't take the medication. That don't make any sense.
And there are some people, let's face it, there are some religious fanatics who say, well, look, I'm going to pray it away. Or I'm going to go to my pastor and my pastor is going to lay hands on me and everything is going to be fine. I don't have to take any medication. Have you come across that?
I mean, certainly, because I guess we come across most things in healing with patients. But what I would always try to tell any patient that says that is, our caller mentioned that, knowledge will increase, etc. And so just give them reference to the Bible as well that suggests that as ages go on, knowledge will increase. And so I still recommend that you pray. This is your belief. I will never tell you not to do it. But it also, in your word, says that the knowledge is increasing, and it has, and therefore I am prescribing you with this medication. Usually there's this story, it's not a health story, but it has to do with someone who's stranded on a rooftop during a storm.
Yes.
And they're praying to God for help. And a man comes by on a boat and they say, no, I'm praying about it. Then someone comes on in some bigger vessel or what's not. A helicopter passes by to save him and he says, no, I prayed, God is going to send. And the moral of that is to say that God sends the help in all these various ways.
Yes.
So then if I can engage the person at their level and try to, yes, validate what they're saying, but also try to get them to understand that the medications and the interventions that we give to them are also appropriate methods of help coming to them.
And God gave us the knowledge
Yes.
to make the medication and to prescribe it.
Yes.
Right.
And to even add a little bit more to it is that medication is research based. Most of these medication before coming on the market takes up to 10 years before they are approved. A simple medication as paracetamol, for example, it has to be studied for years and years using actual subject before these things come on the market. Now, don't get us wrong, we are not saying that these traditional medicines are bad. Other persons do not know, persons cannot benefit from them or whatever conditions they have. However, what you have to bear in mind with a lot of these, that most of them, they do not come with prescriptions, so to say. They do not come with specific instructions to say, well, how long do I boil this? Or do I boil it, or do I just have to eat the bush like that? Do I sip it, or do I dry it? You know, you do not know. So just like with the tablets, you can get side effects from these plants and different sources without even knowing what the side effects are. So that is also something to bear in mind.
Yeah, remember that poison comes in nature too.
Yes.
There are some plants that are poisonous.
Yes.
So because it's natural doesn't mean it's necessarily good.
Right. But there is a place for natural medicine.
Oh, absolutely. Absolutely.
Yes. Now, natural medicine, some people say, also is what you call the herb, you know.
Oh, gosh.
Or cannabis.
Yes.
Now,
Yes.
has there been any medical evidence that you know of, or any study that has been done to show that cannabis can help in the case of NCDs?
Oh, many. Multiple. Cannabis helps with glaucoma. I mean, patented drugs are on the market now, eye drops for glaucoma. Cannabis is known to help, especially in patients who have like cancer and the nausea and so on, they don't want to eat. It helps in multiple myeloma. I mean, there are a number of diseases. Epilepsy. There are some people that have epilepsy fits. The only thing that will stop their fits is marijuana. And so in fact, there's a strain of it in the United States called Charlotte's Web, because there's a little girl called Charlotte, and the only thing that would stop Charlotte's epilepsy was that strain of marijuana. So there's a lot of medical and therapeutic uses for marijuana. And I also want to say that there is no evidence that marijuana increases mortality. With tobacco, we are very, very clear, right? Tobacco causes people to die. Tobacco kills half of its regular users. There's no evidence that marijuana does that.
Okay. Good. Fine. So here we are having this lively discussion. There's a question I want to ask in terms of developing healthy promotion policies. Yes.
Okay, now the Ministry of Health, we do believe in policies, totally believe, and we
It takes more than believing in
and
it.
we and
I'm talking
we
about,
have been-
to enforce legislative and policy actions, because you have to do with more than just believing in.
And so we have been trying our very best to ensure that some of these policies are enforced, and some policies that should exist today in St. Kitts and Nevis that do not exist, to try to put these in place. For example, Professor Samuel spoke about tobacco. We are definitely looking at getting policies as it relates to smoking, having no smoking areas, for example, because persons tend to take that for granted, and most persons would say, well, St. Kitts do not have a smoking tobacco problem. We have a marijuana smoking problem. We don't have a lot of persons who smoke cigarettes. However, they tend to forget that St. Kitts is a tourism country, and majority of the times when these persons come to St. Kitts, you see quite a few of them here walking on the streets, smoking their cigarettes in different recreational areas, smoking. So yes, that is something you don't want
You can't
to
do it where they come from.
Yes.
In some places.
Yes.
Absolutely.
And you don't want to wait until we have a problem to come up with a solution. So policies, implementation of policies, as well as belief, because you don't need the belief in these policies to ensure that they would work. So the ministry is very much aware of the importance of policies, and we keep looking into different policies in order to improve the health of the population.
So there are some policies that the World Health Organization recommends, what they call the best buys.
Yes.
And a lot of these policies are around tobacco, as was mentioned. And St. Kitts really needs to be doing more in terms of controlling tobacco smoke as well as marijuana smoke in public places, because if somebody does not wish to smoke or inhale any kind of smoke, they should be free to do so. So, for example, if you have somebody who works in a bar, that's an enclosed bar, this person does not smoke, and there are lots of people in the bar smoking cigarettes. This person's inhaling tobacco smoke 8 hours a day while they're at work. People like these get lung cancer. They get heart attacks and stroke second-hand smoke. So to protect the public and to get the sustainable development we spoke about earlier, we need to eliminate smoking in enclosed spaces. That is what is being recommended. We also need to increase the taxes on tobacco so that the tobacco smoking will go down and you will have less disease.
What about alcohol?
Oh, yes, indeed.
I know we're speaking out about tobacco and weed and so on. What about alcohol?
Yes, alcohol. A little bit is okay, a little bit. But when you start to get into alcohol abuse, alcohol can kill you in about 30 different ways.
Professor
Seriously.
Samuels, what is a little bit? Because a little bit for me might not be a little bit for
a
you.
little bit
People don't have
is
tolerance level.
1 drink for women and 2 drinks for men per day.
I see. That's the little bit.
Yes.
Okay. Right.
But I usually say to my clients that do not give you permission to me to say you can have, for women especially, you can have a beer every day. Our men say, well, Mrs. Duncan, so I can drink 2, so I'll drink 2 beers every day. Okay? You still need to be a little bit more cautious and remember that alcohol can still be harmful, especially when persons have undiagnosed conditions and they are not fully aware of. You know.
And there are some people who are genetically susceptible to being alcoholics. That is being dependent, physically dependent on alcohol.
Yes.
And for those persons, 1 drink is too many.
Yes, yes. They shouldn't have any at all.
None.
Not even the smell of it. Right, because it throws them into that
Desire.
that
Desire.
That desire.
Yes.
Now, the reason why you are here is that you have the Caribbean Public Health Agency 63rd Research Conference coming up, which starts tomorrow and goes until the 16th at the St. Kitts Marriott under the theme Sustainable Health Systems for Economic Growth, Development and Wealth. Could you shed some light on the theme and perhaps tell us what would be your participation in this conference?
So the theme really is very much related to the discussion that we've been having this afternoon, because we have been talking about sustainable development and the economics and the importance of having the proper health system and the proper health profile of your population in order to drive development. So we will be participating. Dr. Jones is presenting a paper.
Yes.
We have many other colleagues that are presenting papers, research that has been done in the region around, some of these best buys that I mentioned that are very cost effective. In other words, what the cost that what it costs to put the policy in place, the result is more beneficial. So we'll be looking at some of those areas and some of the recommendations that are being made in order to really improve the health of the populations of the region.
Sure. Now, Professor Samuels, you have several publications. What are some of these publications, if you care to tell us?
My research interests really have to do with public health policy and monitoring and evaluation, and have a particular interest in diabetes, quality of care. A couple of the interesting publications that we have done, we looked at the death rates in Belize, which is one of our sister CARICOM countries, and we tried to look at where the highest deaths were by ethnicity and by gender, male, female, and by age. And what we found is that the highest death rates, the highest differences between male and female death rates took place in urban Creole men who had a very high rate of death between about 20 and 30 years old. And we know what that is coming from. And I mention it because I think that if we did a similar study in St. Kitts, we would find the same thing. That there's a very high rate of death of young men in urban situations. So that was one thing that I did. The other thing that I did had to do with diabetes quality of care. And so this is where I came from with this thing about the importance of controlling blood pressure in patients who have diabetes. We have done a lot of work with health systems, looking at how health systems can be designed to better help people to manage their health conditions. We just finished doing a lot of research about the Port of Spain evaluation, so we have a number of papers coming out about that, how we monitored the evaluation, the kinds of environment that encouraged good results from the evaluation. So even big countries did better than small countries. That's not a surprise, because in small countries, we were just in the Ministry of Health. There are personnel in there who have 3 different meetings that they're supposed to be at, because there are just not enough people in the Ministry of Health to go to all the different meetings and do all the different things. So the smaller countries have not done as well as the bigger countries. But the small countries have done quite well when there are what we call toolkits, and when there is guidance and fact sheets and help from a regional level for the local partners to use.
Certainly.
Right. And so it's very important that the regional organizations, CARFA and CARICOM and all these other organizations really look very carefully at what the needs of small countries are, so that they can support them in this way. Yeah. So those were some of the things. We've also, let me just mention one other thing. The other paper we did was called Chronic Diseases and the Law, because the law is very important in terms of helping us. Now everybody knows about tobacco, because the tobacco companies have taken countries to court and trying to stop plain package labeling and all of that. But the big food and big soda also try to fight us in court. There is a educational program which was mentioned in Jamaica that's going on right now, that says, don't drink yourself sick, drink water instead. The company that bottles Coca-Cola in Jamaica sued the Heart and Stroke Foundation of Jamaica over that set of ads, and said that they put up their name on some website for 2 days and they damaged their reputation and all that. So the companies are using the law to attack us, but we also can use the courts to try to create more healthy environments.
Sure. Now, Dr. Jones, could you give us a glimpse of what you'll be presenting on?
Okay, my presentation is from a different aspect of trying to improve or to promote sustainable health systems, and it's actually concerning the use of generic drugs and the role that they can play as cost containment measures given the health financing crisis that all of our Caribbean countries are going through. But it's predominantly looking at primary care physicians in Barbados and how they view the generics, and then seeing if we can go forward outside of this study to encourage further use and more use of generic drugs. So that's what my paper is in a nutshell.
Okay, good. Now I'm going to give we have to wrap up because we're out of time, but I'm going to give the last say to Mrs. Matthew Duncan. What nutrition tips do you have for the audience in terms of fighting NCDs? What wisdom?
Okay, what knowledge?
And knowledge.
Okay, well, for me, I would look at the 4 factors that are usually associated with NCDs, and we're looking at abuse of alcohol, physical inactivity, poor dietary habits, and tobacco smoking. Now, those are the 4 risk factors that are usually associated with NCDs. So if we can usually decrease some of these behaviors as it relates to those 4 areas, which means improving your diet, eating more vegetables, for example. In St. Kitts, for example, sometimes we have this joke in health promotion unit that bread, for example, need to be a food group by itself. Okay, because in St. Kitts and Nevis, majority of the populations, if they do not have bread today, everybody go mad. If there is a natural disaster, for example, let's say a hurricane and the ovens are out and persons cannot get bread, no, that's a big issue for individuals. We need to be very, very aware of what we are eating and what effects these food will have on us. It's not as easy as persons to say, well, you can eat it and you can poop it out. Do not work that way. Funnily, that what the body tends to excrete sometimes is food that would be waste that would relatively be considered good for you, like fiber, for example. And then the body tends to store some of these bad things that you put inside them. For example, fats are stored everywhere and different parts of the body, and you cannot tell your body where to store fat. So if you are going to overeat in fats, the body is going to store it, which means you are going to gain more weight, you are going to become overweight and lead to obesity, and for some individuals, morbid obesity. Carbohydrates, bread, for example, what are they stored at? They can be stored as fats. Okay, these things contribute. Sugars, when we tend to drink a lot of sugar juices, sugar drinks, food drinks, let me say, for example, persons tend to, these things also contribute. Physical inactivity, we need to exercise more. And we also need to ensure that persons who consider themselves physically active, that you actually are physically active. Not the social physical active persons who, for example, it have football season, so I'm engaged in football for this period, I am physically active. I'm a netball player, I'm a basketball player, so it's basketball season, I'm physically active. You need to ensure that you are actively engaged in physical activity at least 3 to 4 times per week for a minimum of less than 30 minutes. Some literature is now saying 20, but I would like to stick with the 30 minutes per day.
And all ages, it doesn't matter the age.
You are never too young or too old for physical activity.
Even walking.
Mm-hmm.
So you need
everybody can walk. Most
can walk.
People can walk. Yeah.
Mm-hmm. I'm always amazed that whenever you go to a buffet, the meat goes.
Oh yes.
And you will see a lot of vegetables.
Yes.
I need to give you a story about that.
Yes.
So on Easter Monday, we had a picnic where I live in Barbados. And of course, I was asked to bring the vegetable because I'm a vegetable fanatic.
Right.
So the lady sitting beside me just had meat and potatoes on our plate. I said to her, you didn't try the vegetable. She said, I don't like vegetables. I said, go and try my vegetables. I said, you know how I fix it? I say, I season vegetables like how you season meat. Mm-hmm. Onion and pepper and garlic and thyme and everything goes in my vegetable. Yeah. And when you cook, she went for seconds. She ate it off and
so
she went back.
It is prepared.
It's how it's prepared, and that's one of the things about vegetables too. Mm-hmm. It has to taste good.
Yes.
We have to cook it up with garlic and pepper and everything, make it taste good. Vinegar must taste good.
Right. Yes. Okay. Is there anything else you would like to say before we close, Dr. Jones?
Well, to just re-emphasize all that we have mentioned today, just to tell persons that are listening and anybody else that may tune in later that food, what you eat, is very important.
Yes.
And so when we look at the related non-communicable diseases, it is very important that you pay attention to what it is that you consume, because as Mrs. Matthew Duncan said, it doesn't just come out. There are mechanisms whereby it will be stored. And so certainly this is something that we want you to be very aware of. And we want you to be aware of the project as well that we will be conducting in your country to try and see how we can produce interventions that can help us with this NCD epidemic that we're currently facing. That's it.
Well, good. I want to thank the three of you so much for coming on today's panel. I know that you are extremely busy. Professor Samuels, Dr. Jones, and Latoya. Matthew Duncan. But thank you so much for taking time out of your busy schedule to be here.
Thank you.
I really appreciate it. And we had a lively discussion, and I hope that people would have listened and taken the advice that you had to give. Thank you.
Thank you.
Okay. So we were listening to three knowledgeable panelists. I had with me today Professor Alafia Samuels. She has Thelma in it, but she likes to be referred to as Alafia, which is her Yoruba name. Mrs. Latoya Matthew Duncan and Dr. Waneisha Jones, talking to us about NCDs, non-communicable diseases that is rampant really in the Caribbean region, and what can be done to reduce their impact on Caribbean populations and health systems. I want to thank all of you who listened to today's program. Those of you who called in, we appreciate you listening to this program every week. We will be back next week with another Working for You program. I am your host, Lesroy Williams. Until then, have a good time.
Working for You. A weekly talk radio program which highlights developments of national interest and the activities of your St. Kitts Nevis government. Join host Lesroy Williams as he presents news, views, reports, and interviews about everything regarding the activities of the Team Unity government and the building of our communities and the development of St. Kitts Nevis. Tune in and call in to interact with your government and share your views regarding the upward forward development of your community and our beautiful Twin Island Federation. Working for You is weekly, every Wednesday live from 1:30 p.m. to 3 p.m. on ZIZ Radio, Win FM, and Sugar City FM with rebroadcast on participating stations. Working for You.
Stay up to date with news, programs, and activities of the government with SKNIS. Like us on Facebook. Listen to us on SoundCloud. Follow us on Twitter. And watch our videos on YouTube. Connect with us today. SKNIS, St. Kitts and Nevis Information Service.